So I'm back with another video, and this is slightly different from the other videos because this is not on a chapter, but it's the format for your A2 evaluation, very highly requested video, especially considering since the retake exam is, I think, 10 days away or so for paper 3. So in this video, I'm just going to be covering the do's and don'ts of an A2 paper 3 evaluation. So how it's different from an AS evaluation and what are the things that you should keep in mind. And we'll also take a look at an example answer from the specimen paper that Cambridge examiners have graded a 10 on 10. And we'll also take a look at some common mistakes which they mentioned in the examiner comments. So let's first start off with what to expect in the evaluation question. Now, keep in mind, you have two evaluations in paper 3. You should know by now that paper 3 is a 60-mark paper. It's for 1.5 hours. And you have two evaluations, one from each option. For example, if you're taking, let's say, health psychology and clinical psychology, you'll have to attempt a 10-mark evaluation for clinical psychology, and you'll have to attempt a 10-mark question for health psychology, all in the same paper. So in AS, you just had to write one evaluation for 10 marks, right, in paper 1. So over here, you have to write 2. So time management is very important. You don't want to spend all your time, or majority of your time in one evaluation answer, let's say for clinical, leaving yourself with very little time to attempt not just the evaluation for health, but the other questions as well. So it's always good to practice evaluation answers way before the exam month, maybe 3-4 months before, just so that you get good practice in and your time management also improves. So let's talk a little bit about the AS evaluation format, and because obviously you do AS first and then you move into second year. So you need to see or understand the differences between the format. In AS psychology, it's a very straightforward 2 strengths, 2 weaknesses evaluation question. You are required to write 2 strengths, and then you're required to write 2 weaknesses, and one of the strengths or weaknesses is going to be given to you in the question. So for example, they'll give you a study, let's say Piliavin, and they'll say evaluate the study by Piliavin in terms of 2 strengths and 2 weaknesses. At least one of your evaluative points must be about reliability, for example. So it's a very straightforward answer. 2 strengths, 2 weaknesses. One of the points must be about reliability. And your strengths and weaknesses are basically points that are research method related. So reliability, validity, generalizability, ethics, data, and so on. So how is the A2 evaluation different from this? So the question will no longer be about an entire section from a chapter. Now, what I'm trying to say here is before 2024, the exam format or the entire exam format was different. I've also posted the whole video on explaining how it was different. But one big difference in the new format is that the evaluation question previously, let's say for example, the topic is, because majority people do clinical, so I'm going to take an example from clinical psychology. Let's say that the question or the topic that they want you to evaluate is treatment and management of schizophrenia, right? So under treatment and management of schizophrenia, you have in your syllabus 3 topics. This is the section, right? The chapter is schizophrenia. You have 3 sections. The first section is the diagnostic criteria. The second section is the explanations of schizophrenia. And the third section is the treatment and management of schizophrenia. Now, under that third section of treatment and management, if they've asked you to evaluate that, you have 3 topics. You have the biochemical the biochemical treatment, which are your typical atypical antipsychotics. You have electroconvulsive therapy, ECT, and then you've got your psychological treatment, which is the study by Sensky in 2000, where we're testing the effectiveness of CBT compared to befriending on patients with treatment-resistant schizophrenia. So these are your three topics under the section treatment and management of schizophrenia. Now, in the previous exam syllabus, in the previous format, the question for your evaluation, if let's say it's on treatment and management for schizophrenia, would be evaluate the treatment and management of schizophrenia, including a discussion on, and then they would give you a named issue. Let's say, for example, reliability. So evaluate the treatment and management of schizophrenia, including a discussion on reliability, 10 marks. Now, they're expecting you to evaluate the entire section of treatment and management of schizophrenia, which means you would have to evaluate the biochemical treatment, you would have to evaluate ECT, and you would have to evaluate the psychological treatment, which was the study by Sensky. So that's a lot of writing if you think about it. That's 3 topics in that section. What about other chapters? Like under OCD, in the explanations of OCD, if they had asked a question, evaluate the explanations of obsessive compulsive disorders, that has 5 topics under it: 2 biological, 1 biochemical, 1 genetic, and 3 psychological. There's the cognitive explanation, there's the behavioral explanation, and the psychodynamic explanation. So you would have to evaluate 5 topics then. And that's going to be a very long answer, which would take up a lot of time. In the newer format, which is what you guys have to prepare for 2024 onwards, the format has now changed where they will not ask you to evaluate the entire section. Instead, they give you selected topics from that section. So instead of now asking you to evaluate the whole treatment and management of schizophrenia, they will ask you to evaluate maybe 2 of the 3 topics, for example, and they'll give you those 2. You don't have a choice in that. They'll tell you which 2 topics from the 3 to evaluate. So for example, instead of asking you now to evaluate the biochemical treatment, ECT, and the psychological treatment, they could just say evaluate the biochemical treatment and the psychological treatment, hence excluding ECT. If they wanted, they could have said evaluate the biochemical treatment and ECT and excluded psychological. If they want, they can also exclude 2 and just give 1. So they could say evaluate the psychological treatment and they could exclude ECT and biochemical. But they usually do that if it's a key study. So if it's, for example, let's say you're talking about the explanations of mood disorders. So you have 2 psychological explanations, you've got 2 biological explanations, right? You have the genetic explanation and you've got the biochemical explanation, which falls under the biological explanations of mood disorders. And you've also got 2 psychological explanations. One is by Beck's cognitive theory of depression, and the other is Seligman's learned helplessness and attribution style theory. So you have 4 topics there. In the previous syllabus, they would have asked you to evaluate all 4. In the new one, they can give you 3 of the 4, or they can give you 2 of the 4, and it could be any 2. It could be maybe 1 from the biological explanation and 1 from the psychological. Like maybe they could say evaluate the biochemical explanation and Beck's cognitive theory of depression. Or they could just give you 1 from the 4, which in most cases would be the key study, which was the genetic explanation, the study by Ork et al., right? The one where we're looking at polymorphisms in the serotonin genes to explain bipolar disorder. So they could ask you, so there's a lot of variability now in terms of how much they are able to ask you, what they will ask you. It's no longer fixed, where it's going to always be one entire section. It's selected topics now, and it could be 2, it could be 1, it could be 3, depending on how many topics there are in that section. So I've given the example here. The treatment and management of schizophrenia. They could ask you to evaluate selected topics, for example, just the biochemical and the psychological treatment. The treatment and management of schizophrenia, they could ask you to evaluate just the biochemical and the psychological treatment of schizophrenia, leaving out ECT altogether. So moving forward, let's use this example. Okay, so the question would be, evaluate the treatment and management of schizophrenia, the biochemical and the psychological treatment of schizophrenia. Okay, at times in brackets, they do mention the name of the topic. So like in psychological treatment in brackets, they might write Sensky 2000, befriending versus CBT. They don't always do that, but sometimes they do. In case they don't, you should make sure you know exactly what topic is falling under that particular section. So if it's saying psychological treatment and they haven't mentioned in brackets that it's the Sensky study, you should know that you have to evaluate the Sensky study. So make sure you know exactly what studies, what topics fall under what heading. Now, along with mentioning the topics, they also give you a named issue, like they did in AS. And this named issue, unlike in AS, does not always have to be a research method evaluative point. It could now also be an issue and debate. So another big difference between AS and A2 evaluations is, in AS, we are not required to use issues and debates. And how many issues and debates are there in AS? We've got application to everyday life, you've got the nature-nurture debate, you've got the individual and situational explanation. Yes, you also have use of animals and use of children in psychological research. That has come a couple of times as the named issue in AS evaluations in some past papers, but typically it's more about just using research method terms, like I said earlier, reliability, validity, generalizability, data, experimental design, sampling technique, etc. But in A2, they can tell you to talk about an application to everyday life or a nature nurture point. Basically, they can ask you to evaluate it in terms of an issue and debate. So it could be the nature nurture debate, the individual situational explanation, application to everyday life, or any of the A2 issues and debates: reductionism, holism, determinism, free will, nomothetic, idiographic, cultural bias. Okay, it can also be on the research method term. So it's not that the named issue will always be on an issue and debate. It can also be on a research method term. So this question could be, evaluate the biochemical and psychological treatment of schizophrenia, including a discussion on the nature-nurture debate. Or it could also be, evaluate the biochemical and psychological treatment of schizophrenia, including a discussion on generalizability, for example. So you're not restricted to just research methods, you're not restricted to just issues and debates. You must use, or you can use, both. And the named issue can be in either of these. So that's the first couple of points about what to expect in the evaluation. Now let's talk about what to write in your evaluation. How do you format the answer? So I've explained the differences between the AS and A2 evaluation, and also the new A2 evaluation format compared to the old one. And I think the new one is easier and better because, again, at the end of the day, it's fewer topics to write about. And going back to the earlier point about using issues and debates, the reason why you are required to use issues and debates, or it's recommended that you use issues and debates in A2 evaluations, although we never use them in AS, is because in AS, all 12 chapters were studies, which meant that there was a sample, which meant that there was a procedure, which meant that there were results. So you would be able to use research method terms like generalizability, like data, okay, like ethics. But in A2 topics, in A2 chapters, you will see that not every section has studies. A lot of the topics are just theories or concepts without any procedure to back it up, without any sample or any results. So if you don't have a study, if you don't have a sample, if you don't have a procedure, if you don't have results, if you don't have an aim, you can't really use points like ethics and generalizability and quantitative data and qualitative data, etc. So if you can't use those terms, if you can't use the research method terms, then you're kind of confused. Okay, if I can't talk about generalizability, if I can't talk about ethics, if I can't talk about data, then what do I talk about? That's where you that's where your issues and debates will come in handy. So that's where you'll be required to talk about, if this particular theory is nomothetic or idiographic. Is it deterministic or is it free will? Is it reductionist or is it holistic? So that's why your issues and debates are going to be very helpful in A2 evaluations. So what is it that you're supposed to write in your A2 evaluation? So building on the point I just said, you should include a range of evaluative points, including strengths, weaknesses, and issues and debates in your answer. In fact, the question now even says they add an extra line after saying evaluate so and so topic, including a discussion on, and then they'll give you a point. They add another line after that saying your answer may include strengths, weaknesses, and a discussion on issues and debates. Okay, so it's recommended that you have a range of points. So strengths, weaknesses, and issues and debates. Strengths and weaknesses, you can talk about your points such as reliability. You can use, let's say, for example, reliability as a strength, use validity as a weakness, okay? And then also maybe talk about the nature-nurture debate. So mix it up, have a good range of points. So include research method points, include issues and debates. And if you feel that you cannot include research method points at all, that's also fine. Then just talk about the issues and debates. You can even mention the strengths and weaknesses of the issues and debates if you want. So not only would you say that, okay, it's favoring the nurture side or favoring the nature side, but if it's favoring the nature or nurture side, you can give a strength or weakness about why, it's favoring, or if it is favoring the nature side, why that's a strength or why that's a weakness. So you can actually include strengths and weaknesses as part of your issues and debates. So it's important to know the strengths and weaknesses of the issues and debates. And I think there's a video also that I posted on that, which you can take a look at. A well-planned evaluation should have a minimum of 3 evaluative points. Now, some teachers will say you should have 4 points because, that's what we did in AS, 4 points, 2 strengths, 2 weaknesses. And there's nothing wrong with having 4 points. There's nothing wrong with having 5 points also. But if you look at the examiner report, examiner comments for the sample answers, which I'll show you later, they mention that it's always better to have 3 detailed, well-planned evaluative points rather than maybe 4 or 5 points where you're just trying to write more, but it's not of good quality. So vague answers, not very elaborate. You've written 4 or 5 points, but it's 5 weak points. 3 strong evaluative points are better than 4 or 5 weak evaluative points. And the best thing about 3 points is that you're saving time also. Writing more points means taking up more time. And you need as much time as you can get in paper 3. So if Cambridge is saying, stick with 3 evaluative points, it's recommended to stick with 3, then why not stick with 3 good points? One of which will obviously be the named issue. Okay. So if they're saying evaluate the treatment, the biochemical and the psychological treatment of schizophrenia, including a discussion on the nature-nurture debate, then one of the 3 evaluative points will be the nature-nurture debate. The other 2 can be any of your choice. It could be an issue and debate, it could be a research method point, it could be anything. Okay, application to everyday life, for example, reductionism, holism, for example, generalizability, for example. Okay. Next point, begin each evaluative point by describing it. So how do you start off your answer? That's another question students keep asking me. Do you need to give an introduction? Do you start off by explaining or describing the topic? So do you give an introduction where you describe what the biochemical treatment of schizophrenia is? Do you start by describing what the psychological treatment of schizophrenia is? The short and simple answer to that is no. There is no need to describe the topic because you have to remind yourself about the format of the exam for paper 3. You have a 6-mark question right before the 10-mark evaluation. And the 6-mark question and the 10-mark question are always on the same topic, which means if you are required to, if your question is, let's say, on the biochemical and the psychological treatment of um, schizophrenia, and it's 6 markers, so it'll say describe the biochemical and psychological treatment of schizophrenia. You just have to describe it. You have to give a summary. Part B would be evaluate the biochemical and psychological treatment of schizophrenia. So the 6 mark describe and the 10 mark evaluate are always going to be on the same topic. And in the 6 marker, you've already described it. So do not waste time describing it again in part B in the evaluation. Yes, you can refer to points if need be from the topic, but that's different from giving a summary. So you do not need to start your answer off by describing the biochemical treatment of schizophrenia or the psychological treatment of schizophrenia, because you've already done that in part A. So instead, how do you start? So instead of starting with the topic, for example, the biochemical treatment of schizophrenia, start off with the evaluative point, and always start off with the named issue, the named evaluative point. So if the question says including a discussion on the nature-nurture debate, then your answer, your first paragraph could be one issue that we can discuss with regards to the biochemical and the psychological treatment of schizophrenia is the nature-nurture debate, and give a brief explanation or description of the debate. Explain very briefly in 1 to 2 lines what the nature-nurture debate is. So that's how you can start with your answer. Okay, begin each evaluative point by describing it. If it said that, including a discussion on generalizability, then you can start off your answer by saying one issue or one point that we can, or one strength of the study is, or the topic is generalizability, or one weakness is generalizability. Briefly describe what generalizability is. If you're talking about reductionism, holism, briefly describe what reductionism, holism is. So start your paragraph, start your answer off by briefly describing the named issue. So I've said that a well-planned evaluation will have a minimum of 3 evaluative points. Point number 5 is very important. Structure the answer such that you're writing your answer, such that you are writing your answer, that the evaluative point is what you're starting off with. So you would think that you need to write your answer in a way that you are first entirely evaluating the biochemical treatment of schizophrenia, and then you're evaluating the psychological treatment of schizophrenia. So by that, I mean, so we discussed that we need 3 evaluative points, right? Let's say nature nurture, because that's the named issue. And let's take 2 more. Let's take individual and situational explanations, and let's take application to everyday life. Okay. So you've decided that these 3 are the evaluative points that you want to talk about. Okay. You decided you don't want to go for any research method point, because the biochemical treatment does not have any major study that you can really refer to. So you decided that, okay, let's talk about the nature-nurture debate, because that's the named issue. Let's talk about the individual and situational explanations. And the third evaluative point that you want to use is application to everyday life. So you would think that you would start off with the biochemical treatment, in which you would apply the nature-nurture debate to the biochemical treatment. Then you would apply the individual situational debate to the biochemical treatment. And then you would talk about the application to everyday life of the biological treatment. And you're done with half of your answer. And then you would think, okay, now I'll move on to the psychological treatment, where I talk about nature-nurture for the psychological treatment. I talk about, let's say, what was the second one? Individual situational explanations for the psychological treatment. And then in the end, I'll end it with application to everyday life of the psychological treatment, right? So the way that this answer is structured is you're evaluating it topic wise. So first the biochemical treatment, sorry, and then the psychological treatment. That is not the recommended format. Okay, the Cambridge examiners say this is not a recommended format. They do not want you to evaluate it topic wise. Instead, they prefer it if you evaluate it um, evaluation point wise. Now, what does that even mean? So instead of evaluating the biochemical treatment in three evaluative points entirely, and then moving on to psychological, start your answer by picking your evaluative point, let's say the named issue, nature nurture, briefly describe the nature nurture debate in 1 to 2 lines, and then apply the nature nurture debate to the biochemical treatment, and then apply the nature nurture debate to the psychological treatment. So you're not doing it topic wise now, you're answering or structuring your answer evaluation point wise now. So I'll repeat. You start by saying one issue that we can apply to the treatment and management of schizophrenia is the nature nurture debate. Briefly describe the nature nurture debate, and then apply the nature nurture debate to the biochemical treatment of schizophrenia. Talk about both sides where possible. Okay. Explain how it's favoring the nature side, and if you can, not there's no guarantee that both sides will apply, but if you can, talk about the nurture side as well. If you can't, that's fine. Just stick to the nature side. So you've applied the nature nurture debate to the biochemical explanation. And then you move on and you apply the nature nurture debate to the psychological treatment. Sorry, not explanation, the psychological treatment. So you talk about how the psychological treatment can be supported by the nurture side of the debate. And if you feel that you can talk about the nature side as well, talk about it. So it's recommended that you talk about both sides of the debate where applicable. If only one side is being favored, then fine, just give one side. Don't need to mention both sides. But if you can, then mention both sides. So nature nurture debate applied to the biochemical treatment, nature nurture debate applied to the psychological treatment. Okay, so like I said, where possible, apply both sides of the debate. Example, the nature side as well as the nurture side, where possible. And give obviously examples and evidence from the topic to support your point. Don't give vague answers, give elaborate, detailed answers. If you're saying it's nature, what is the evidence from the study that it is nature? If you're saying it's nurture, what is the evidence from the study that supports that it is nurture? Okay. If it's nature and nurture, what is the evidence that is supporting both sides? Once you've given the nature nurture debate for the biochemical treatment and the psychological treatment, end your paragraph with a brief conclusion where you're just summarizing your points. And that is your entire first evaluation point done on nature versus nurture. Then you move on to your second paragraph where you now pick a second evaluative point of your choice. We decided we would go with what? Individual versus situational explanations. How do we start? A second evaluative point that we can talk about, or a second issue we can talk about, is the individual and situational explanations. Briefly describe the individual and situational explanations. Very briefly, just like we did for nature nurture. And then apply the same format. Talk about the individual and situational explanation for the biochemical treatment. Talk about both sides where applicable and give evidence from the topics. And then you talk about the individual and situational explanation for the psychological treatment and give both sides where possible. And if both sides are not applicable, only one, then talk about one side. And then give a little brief conclusion to end your second evaluative point, your second paragraph. And then you move on to your third paragraph. You pick a third evaluative point, let's say application to everyday life. Briefly explain what that is. Talk about how the biochemical treatment is applicable, talk about how it isn't applicable. Then you move on to the psychological treatment, talk about how it is applicable, talk about how it isn't applicable. If only one side is being favored, then just mention one side. And then give a brief conclusion summarizing your points. And that is the end of your answer. That is how you write a good 10-mark evaluation in paper 2. That is the format, that is the structure. It seems a little confusing, especially because the AS format was very straightforward. So this is a complete contrast to what we were used to in AS. Another big difference is that in AS, you had to write your evaluation. In fact, all your answers on the question paper. In A2, you'll be given a separate answer booklet. So you won't have that restriction with the lines now. You can actually write as much as you want. A good evaluation is around 2 pages, because some people write 3, some write 4. Only write that much if your time management is good. But otherwise, 2.5 pages is the minimum. Okay, we've talked about what all to write. Let's talk about what is not important. What are the don'ts of the evaluation? What not to write? As I mentioned earlier, do not waste time describing the topics. Do not waste time describing what the biochemical treatment is or what the psychological treatment is, as you've already done that in the 6-mark describe question in part A. Choose the 3 evaluative points that allow you to write different points and avoid repetitive points or repetition of points. So what that means is, let's say that the first paragraph, the first evaluative point was the nature-nurture debate. And then you decided to talk about, in the next paragraph, as your second evaluative point, the determinism versus free will debate. And then in your third evaluative point, you decide to talk about, let's say, the reductionism versus holism debate. Yes, these are 3 different evaluative points, but the problem is that the evidence that you would be supporting your evaluative points with would be similar. For example, in the nature-nurture debate, we'll be talking about the biochemical, side of your answer. You'll be talking about how the treatment is supported by biological factors, antipsychotic drugs, how they work, how they block the dopamine receptors. So it's clearly a biological aspect. There's a biological aspect to it, which is why it's nature. So you've talked about it in your first paragraph. But in your second paragraph, when you've decided to go for determinism, and you're talking about how the biological treatment is, let's say, deterministic, or let's say it's, the biological explanation is deterministic. If you've already talked about nature in the first paragraph, to support your point about determinism, you may need to talk about nature again. So you will just be repeating points in your second paragraph from your points in the first paragraph. And let's say now in the third paragraph, you want to talk about reductionism versus holism. And you're saying that, it's reductionist. Why is it reductionist? Because it's only focusing on biological factors. Again, repetition of the nature point. So it's better to choose 3 evaluative points where you can talk about different points and there is no repetition of points. So when we say a range of evaluative points, we don't only mean, picking issues and debates and, your strengths and weaknesses, research method points, but even within the issues and debates, pick points where you're not repeating. You're less likely to repeat points from paragraph to paragraph. Okay, and the last point, like I said, stick to 3 points, 3 evaluative points, no need to write 4 or 5. Let's take a look at an answer. This is a specimen paper question. Evaluate the psychological explanations, and like I said in brackets, they mention sometimes cognitive, behavioral, and psychodynamic of OCD, including a discussion of individual and situational explanations. This is an answer that was graded a 10 on 10. So like it's a specimen answer, high. As you can see, they're starting off by immediately getting into the first issue, and they'll start off with the named issue. One issue that can be applied to these explanations is the individual and situational explanations. The behavioral explanation can be seen to be situational. So this answer is getting right into the topic. Now, if you remember, I said it's good to always start off by explaining the named issue or explaining the evaluative point. So at this point where he's saying the behavioral explanation can be seen to be situational, as the patient with OCD will experience anxiety and so on. Instead, over here, he could have started by briefly explaining the individual and situational explanation. The examiner comments, which are not mentioned over here because otherwise I would have to fill my page up with a lot of points, these slides up with a lot of points, but in my Google Drive, which you guys can have access to if you just reach out to me in the on the number or email that I provided. I will give you access to my Google Drive. There is a folder by the name of Specimen Paper Sample Answers. So you can take a look at the paper 3 specimen paper sample answer, where you will find this exact same answer. You will find a page with the examiner comments under this answer. And in that, the examiner has actually said it is better if the candidate briefly explains the evaluative point. Now, the reason why it didn't matter here is because the evidence that this candidate is giving clearly shows that they do have an understanding of the individual and situational explanation. So the only reason they want you to give a brief explanation or description of the evaluative point is so that the examiner knows that you know exactly what is this debate, what is this point, you know what is required and what you have to write in this point. So you don't have to give a brief description of the evaluative point, as long as you give evidence in your answers showing the examiner that you know what you're talking about, that's good enough. But it's still recommended. Why not just be safe and just give a brief description to let the examiner know that you know what you're talking about. That's something that this candidate could have maybe changed in their answer. But they didn't. Instead, they go right into it by saying the behavioral explanation can be seen to be situational, as the patient with OCD will experience anxiety due to the situation that they are in, such as seeing unclean surfaces. So he's saying that the behavioral explanation, which is this one, is situational. So he's talking about the situational side and he's giving evidence from the topic. If the patient with OCD avoids these situations, then their anxiety will be lower. So evidence showing why it's situational. But he's now giving the flip side about how it's individual also. However, this explanation can also be seen as individualistic, as each individual will be different in terms of what causes them anxiety. Some patients may feel anxious in disordered environments, and others may feel anxious in unclean environments. So he's talking about the situational side with good evidence. He's talking about the individual side with good evidence from the topic, with good analysis of the topic. And then he gives a conclusive point. To conclude, this explanation offers both an individual and situational explanation, and also highlights how these two explanations intersect. The situation that causes anxiety will be different for each individual, but the reaction to that situation will be the same, high levels of anxiety. So this was a very good way to talk about the individual and situational debate for the behavioral explanation. But he's got two more. So he goes on to now apply the individual situational explanation to what? To the cognitive explanation. The cognitive explanation is similar in offering both individual and situational explanations. The type of obsessive thinking will be unique to each person and therefore individualistic. However, stressful situations can cause all patients with OCD to feel more anxious and experience more intrusive thoughts. So talking about individual and situational sides for the cognitive explanation. Now keep in mind, I told you that they usually don't give you three topics, right? Like we had the biochemical explanation, we had ECT, and we had the psychological, and they only give two. The example that I was talking about, I only gave two. I excluded the ECT. So you're probably wondering, why have they given three over here? At the beginning of the lecture, I said some topics, like the psychological explanations of OCD, have four or maybe even five topics in them. So this section, the explanation of OCD, the explanation of OCD has five topics, two biological and three psychological. So the previous exam would have asked you to evaluate all five, these three, including the genetic and the biochemical explanation. So they've still given a select number of topics. It's still three, but that's because the overall size is five. The overall number of topics in this section is five. And they've chosen to give you all psychological explanations. So this would potentially be a long answer because now you have to evaluate three topics instead of two, like in the previous example where it was just the biochemical treatment and the psychological treatment. But what this candidate has done, which is something that you can also do, if you have, let's say, three topics to evaluate and not two, cognitive, behavioral, and psychodynamic, in his first paragraph where he's talking about the individual and situational explanation, he's applied it to the behavioral explanation and he's applied it to the cognitive explanation. He hasn't applied it to the psychodynamic explanation. Why? Because he will talk about the psychodynamic explanation in the next paragraph with his second evaluative point. So let's take a look. A second issue that can be applied is the nature versus nurture debate. The behavioral explanation is on the nurture side of the debate. He's explaining why. Because OCD can develop through learning via negative reinforcement. And he basically gives examples and evidence about that. Patient continues to engage in compulsive behavior more and more as they have learned this behavior will reduce their anxiety. So a lot of evidence as to why it's nurture. And then he's talking about the nature-nurture debate for the psychodynamic explanation. So the first paragraph for individual situational, nothing on the psychodynamic explanation was mentioned. This is the first time we were talking about the psychodynamic explanation. The psychodynamic explanation is similar to the behavioral explanation as it suggests that it is the early life experiences during the anal phase of development that can affect whether a person develops OCD later in life. If these experiences are positive and the anal phase is successful in childhood, OCD will not develop. However, if there are unresolved conflicts with OCD, then OCD can develop, and this therefore is supporting the nurture side. But then he's giving the opposite side as well, nature. However, the psychodynamic explanation, in contrast to the behavioral explanation, can also support the nature side of the debate. So he only talked about the nurture side for the behavioral because nature cannot be supported. But he feels that nature-nurture can explain the psychodynamic explanation. So he's talked about how it's nurture, and now he's explaining how it's nature. It suggests that everyone will experience the same psychosexual stages of development. Everyone will go through the anal phase of development, which suggests that it is innate. And then he gives a conclusive point. To conclude, the behavioral explanation is solely on the nature side of the debate, whereas the psychodynamic explanation supports both sides of the debate. And in this second paragraph, there is no mention of the cognitive explanation. So what this candidate is doing is, rather than talking about all three topics in the first paragraph, all three topics in the second paragraph, all three topics in the third paragraph, he's choosing two of the three in the first paragraph. He's applied nature nurture to that. He's choosing, individual situational to that. He's choosing two topics in the second paragraph. He's applied individual situational to that. And he'll choose two topics in the third paragraph and he'll apply his third topic. So that is something that you can do if you have many topics. If you have at least three topics to evaluate, you can pick the first two, like cognitive and behavioral for the first evaluation paragraph. Then you can pick on the second and third for the second evaluation paragraph, which is behavioral and psychodynamic. And then in the third paragraph, the third evaluative point, you can pick the first and third, which would be cognitive and psychodynamic. So let's see if that's what he's doing. The final evaluation point is determinism versus free will. Now, I told you that you should try to avoid repetition. So personally, I would not have gone with determinism free will because I've talked about nature nurture. So I feel that maybe some points might be repetitive unless you can write it in a way where you're not repeating points. Maybe I would have gone with application 2, everyday life. But let's see what this candidate has said about determinism free will. And as you can see, he's brought back the cognitive explanation. And the second one he'll be talking about should be psychodynamic, which is it mentioned over here? I think it is mentioned over here. Yes, over here, the psychodynamic explanation. So he's excluded the behavioral over here. So, and I think this is smart because if you had to talk about all three, cognitive, behavioral, and psychodynamic for individual situation, for nature nurture, for determinism free will, that would be a lot of writing and that would take up a lot of time. So you are covering all three topics. We're just choosing which ones to cover for which evaluative point, and you can do that when you have three topics to evaluate. If it was, let's say, only behavioral and only psychodynamic, then you would have to talk about both in all three paragraphs. Okay, so this is something new that we're learning. The final evaluative point is determinism free will. Again, I just recommended that you then briefly describe this and then apply it. The cognitive explanation supports both sides of this debate. It suggests that the thoughts are intrusive, so the patient doesn't have control over them, which is which is deterministic. In addition, stressful situations, which often the patient can't control, can make these thoughts more frequent or of greater intensity. So this is favoring determinism. However, the patient can learn some control over their condition by going to therapy, such as exposure and response prevention. He's given evidence from a topic in the syllabus. The patient has the free will to expose themselves to things that they are frightened of and can then experience lower anxiety levels. As the anxiety levels drop, the patient will experience lower obsessive thoughts. In contrast, the psychodynamic explanation offers a deterministic explanation, as it suggests that the cause of OCD occurs during childhood. The anal phase of development happens when we are very young, and so we should not have much control over how we are treated during this phase. It's very easy to end up talking about nature over here. So you will be repeating points in the previous chapter, in the previous, sorry, not chapter, in the previous paragraph, which is why I think it's better to be a little different in your answers. So he's being very careful to try and not repeat the point about how it's innate. To conclude, the cognitive explanation offers both a deterministic and free will explanation, suggesting that OCD cause is deterministic due to the obsessional thinking, but the patient can gain control over their disorder with the help of therapy. The psychodynamic explanation is more deterministic, as it suggests that the disorder develops in childhood, where we have less free will. So vague points in the last evaluation paragraph, I feel. I think as if you guys are, when you guys take your exam and you're writing the evaluation, I don't think you should be as vague as this. You might get a slightly more strict examiner who might not give you a 10, might give you like an 8 or 9, which is obviously still a good score, but we want to aim for a 10. So I feel like the last evaluation paragraph that he wrote, it was a little vague, especially for the psychodynamic explanation. It's almost like he just wanted to finish off the answer. So maybe in your exam, if you have time, write a slightly more elaborate answer than this. But if this is being given a 10 on 10, then that's great. Shows you that you don't have to have a completely perfect answer to get full marks. Now let's talk about some common mistakes which the examiner has pointed out, which you should definitely avoid. Candidates cover the named issue in detail, but no other issues. So talk about the named issue in the first paragraph, but then have at least 2 more. Candidates do not cover the named issue at all. So you forget to talk about the named issue. You talk about 3 really good evaluative points, but if none of them is the named issue, that's, I think, at least 4 to 6 marks gone. I think 4 marks. When candidates give too few examples to explain evaluation points, so give sufficient and elaborate evidence from topics in your syllabus to support your evaluative point. Candidates do not give definitions of the issue. So, like I said, it's always good to give the definition of the issue unless you've shown that you clearly have an understanding. Like it says, and it is unclear from the evaluation that the candidate understands this issue. So that's why it's safer to always start off by giving the description or explanation of the named issue or any evaluative issue that you're talking about. There is no analysis or very limited analysis. For example, using phrases like similarly and in contrast without explaining why the explanations or treatments or theory are similar or in contrast. So you're saying similarly, the psychodynamic explanation is also deterministic, but you haven't given any explanation as to why. An extreme view is presented. Example, an explanation is fully deterministic, rather than a balanced explanation of how an explanation could be considered to support both sides. Of course, yes, there might be some topics which might be only nature and not nurture, only deterministic, not free will. But if there is evidence to talk about both sides, then don't just mention one side. Talk about both sides of the debate. Yes, one might be favored more than the other, but then you can write that in your conclusive point, right? Like in this answer, the candidate in the conclusions did say, to conclude, so and so topic is more, let's say, individual than situational, more nature than nurture, more deterministic than free will. But both sides were mentioned. Okay, so I hope this video was helpful. I will upload a video on the AS evaluation as well, which is much easier. But if anyone has any confusion, which you still might, because this was not an easy format to understand, and it takes a bit of practice to perfect this. So if you still have any queries, questions, please feel free to comment below. And you can always email or contact me on WhatsApp as well, and I'll be more than happy to help you guys out. Okay, so thank you guys, and we'll be back with more. Take care and bye-bye.